Hi, this is Dr. Rahman Khan, consultant internal medicine. Today's subject is plaque. Arterial plaque obstruct the coronary artery and any artery in the body. We are talking about the coronary artery now, which can cause heart attack. Coronary artery obstruction is very serious. It can cause obstruction and cause heart attack, and heart attack can kill you. In the United States of America, every 40 seconds, a person has heart attack. Annually, more than 800,000 people has had a heart attack. We have to know how arterial plaque is formed. Arterial plaque is not formed overnight. It takes decades to have a arterial plaque to obstruct the coronary artery, which can cause heart attack. Therefore, it is very important to know a lot of factors regarding this heart attack. Let's talk about the factors now. Number one is if anybody has a family history of heart attack at the age of 45 and above for male, at the age of 55 or above for the female. If the patient has diabetes, high blood pressure, high cholesterol, if the patient is obese, patient's lifestyle is sedentary, patient does not exercise, if he smokes, uses drugs such as amphetamine, cocaine, or other illicit drugs. These are the factors. In addition, if the patient has rheumatoid arthritis, lupus, or familial hypercholesterolemia. Familial hypercholesterolemia, if one of your parents has a defective gene, then you might have a lot of LDL cholesterol which cannot be removed by your body. In that circumstances, you might develop early heart attack or a stroke, and you may die in your early age, during childhood, even adolescence. This is very important to know that you have to check the cholesterol if there is a family history of familial hypercholesterolemia. Familial hypercholesterolemia is manifested by xanthoma and xanthelasma throughout your body that can be detected by the patient and report to the doctors, and the doctor diagnose the case. There are fatty deposit on the hands, elbows, knees, ankles, and eyelids. We call xanthelasma under the eyelid, and on the body, xanthema. And that person has high cholesterol if you do a blood test. And maybe even in genetic study, we can determine that he has a familial hypercholesterolemia. Most of the patient dies of heart attack from acquired hypercholesterolemia, not the familial hypercholesterolemia. Acquired cholesterolemia, as I have mentioned, due to the lifestyle. Like if a patient is sedentary, does not do exercise, if patient is obese, if he smokes, if he drinks a lot, if he abuses drug, especially amphetamine, cocaine, if patient has high blood pressure, has lupus, rheumatoid arthritis, uncontrolled diabetes. These are the few of the factors that he must address and stick to a low-fat diet, low cholesterol diet, do physical activities, at least 30 minutes a day of brisk walking, biking, or jogging, or swimming. He must quit smoking if he is a smoker. He must not indulge in illicit drug abuse, he must control the diabetes, hypertension, hypercholesterolemia, and has to manage the stress if he has one. Patient must be careful that he may have anytime have heart attack if the patient has uncontrolled diabetes, uncontrolled hypertension, uncontrolled dyslipidemia, high cholesterol. So he needs to check the cholesterol time to time, check his weight. If it is above 25 in context of BMI, which we call body mass index. Body mass index 25 and above is a risk factor. Like for women, 35 inches waist circumference, and for the male, 40 inches waist circumference. That's abdominal obesity is another way to say. Therefore, we have to address the risk factors, and if we address the risk factor, if we change the lifestyle, maybe we can prevent heart attack. Thank you. I hope that you have enjoyed this small video, and please subscribe so that we can continue the channel smoothly. Goodbye.